Thanks for having me. It's really great to be here and to share a bit more about who we are and what support we can provide to your community. My name is Kyri Photiou and I'm Head of Information, Helpline and Support at Muscular Dystrophy UK. The work the team and I do is predominantly through support through like our helpline and advocacy service, which I will share more as I go along. I can see there's a bit of a delay, but hopefully everyone can hear me all right.
Yep, it's fine.
Lovely. So I thought I would start off by explaining a little bit about who we are as a charity. So we're the charity connecting our community of more than 110,000 people with one of over 60 different muscle wasting and weakening conditions and all of the people around us. So, essentially we can all get the healthcare, the support, the treatments we need, to feel good mentally and physically. So there's sort of 4 key areas that sort of we do that in, so funding groundbreaking research to understand different conditions better and to lead us to new treatments. We work, so one of the things about research, we were recently really delighted to announce that we have awarded 11 new grants worth over 1.3 million to research projects as part of our 2023 grant round, which is amazing. These different research projects have all aimed at improving diagnosis, monitoring progression, and testing potential new treatments for muscle conditions. And as a total, it brings the number of research projects we funded to 43. The new research projects are covering a variety of different muscle conditions, such as a reed-specific type of myopathy, Becker muscular dystrophy, CMT, Duchenne, mitochondrial, and lots of others as well. Secondly, we work with the NHS towards universal access to specialist healthcare. Together, we campaign for people's access, their rights, better understanding, accessibility, and access to new treatments. One of the things our sort of policy and campaign team do is sort of work to improve the quality of life of people with muscle wasting conditions, for them to have access to specialist healthcare, support and emerging treatments they need as soon as possible. And we do this by bringing people together with muscle wasting conditions alongside healthcare professionals and decision makers within NHS and other organisations, and make sure that the voice of the community is heard in Parliament across the UK. So really recently, sort of some of the evidence we've provided to the Levelling Up and Housing community committees was about the housing sector and the issues within the housing sector for people with disabilities, so living in unsuitable homes and how that can negatively impact people with muscle wasting weakening conditions. And as part of this, we called on the government to implement better accessibility standards for new homes and to improve the Disabled Facilities Grant. And lastly, sharing advice and support to people for them to sort of live well now, and that's sort of what I'll be talking more about today. So I wanted to share a bit about who our team are. So we're a team of about 9, and we're based all over the UK. The support that the team and I provide is based out of the London head office, so we cover England, but we've got team members all over the UK, so Scotland, Northern Ireland and Wales, and all of us support to provide help through our charity helpline. So we know a diagnosis and living with conditions can change everything. It can present lots of different challenges, and we're just here on the other end of the line to support individuals, families, carers, making sure people have access to the right information. We know that can help make all the difference. So you can contact our helpline, which I'll send in the chat at the end of the presentation, on 0800 652 6352, or email us through our mailbox, and one of our team will respond to you and take it from there. I just thought I would share a little bit about what we can support with. So there's a range of things really. So we would just definitely encourage anyone to get in contact with us if you're having difficulty with things like benefits, care packages. It could be, education, employment. There's a real range of things. So we're here to sort of give information, advice, and signpost as much as we can. I think Pinky and Sarah spoke about some of the support they provide for like education and employment, and we can do sort of similar things. A lot of what we can do sometimes is sort of work together with some of the team members in the clinic to provide additional support as well. So one of the things that we do look at is advocacy support. So we sort of provide informal advocacy support. That's where there are sort of bigger challenges, more complex situations potentially. So things like housing, care, care packages through NHS, for example. And our role is to support people with conditions to try and get the support that they're entitled to. So we sort of support quite a fair bit with benefit applications or supporting people to appeal benefit applications if they come back with a decision that doesn't reflect how they're affected and therefore means that they haven't been entitled to that payment of a particular benefit. So benefits like PIP, for example, so personal independence payments. But it doesn't necessarily need to be benefit. It could be like if someone's on a particular housing banding and they feel like they need to, and they've been on there for a long time and they want to try and access a higher banding. So we are there to support that as well. And the key thing is we just encourage people to get in contact first to see and then what we do is we encourage someone to sign a consent form, which is where we can then sort of become more involved by talking to whether it's a DWP or a council. And then depending on what support is needed, we can put together a letter. What we try and do is sort of reiterate any concerns that someone may have, raise awareness about their condition. Yeah, we can talk to the organisation or company directly, and we can also share specific condition information as well, which we know can be quite problematic when a lot of conditions are very often misunderstood, and that's particularly common of muscle wasting and weakening conditions. Another thing we sort of try and do as well is encourage people to use their voice when they can. So self-advocating. So we want to support people as much as we can to achieve the best possible outcome and positive outcome. And what we do is we speak alongside you. We don't speak for you. So we sort of support people to self-advocate where they can. And the community do this like a huge amount anyway. But it's just making sure that your voice is heard and that your needs and wishes are being heard too. So there will be certain cases or particular instances where we can't particularly advise, so potentially like a legal issue, but what we'll do is we'll always signpost and refer on to a different organisation where their specialism is better suited to your needs. So that's a little bit about what our team do in terms of sort of the helpline advocacy support, but I thought I'd share a little bit more about what other areas of support there are. So one of the big things is information. Sarah talked about the fatigue guide, which she worked on alongside a number of other specialist physios. But a lot of what we have is accessing information on conditions, so practical guides, information videos. We have a range of online webinars and videos for people to access. And there's also a lot of professional learning upskilling for the healthcare community that some of our colleagues in the commissioning team sort of run. So lots of information for people to access should they need to know more about their condition or share information with others who don't know about their condition. And I thought I'd mention that we have recently embarked on a 2-year project within my team that it's specifically focused on updating, improving and reviewing our information to make sure that our condition fact sheets and other resources are more inclusive, accessible, and to ensure that we have information to cover as many of the conditions that we cover, because as I said, there are over 60. And also thought it might be helpful to note we've obviously recently changed our branding, so some of you might notice the logo is a little bit different. So we'll be sort of phasing in the new branding as and when we update those publications. And if anyone wanted any of these publications, I would just encourage you to contact our helpline team and we can post certain items out to you or email over, etc. And then I wanted to move on to a bit about the support in the community. So one of the things we've noticed is that, having a condition can mean adjusting to a new and unexpected reality. And we know that meeting others in similar situations can be really helpful. So as a charity, we can put you in touch with other people who understand what it is also like to live with a condition. So we do that through our peer support volunteer network. which is made up of over 40 volunteers with a personal experience of living with a condition or supporting someone with a condition. So we have grandparents, parents, siblings, carers also within this network of volunteers. They've all had sort of training through our team, external organisations like Samaritans, as well as safeguarding training to make sure they're sort of taken care of when carrying out the role and making sure everyone's looked after. So if anyone was interested in the peer support network, again encourage you to email in, call our team, and there's also a web form which I can share after the presentation in the chat if that would be helpful. Some of the things that how the peer support volunteers support is they can support if someone's newly diagnosed. It can be at any stage of someone's journey, providing support to family members, parents and carers who have perhaps have their own challenges when supporting someone with a condition, and we know that can be really valuable to speak to someone else. And they, sharing their experience of managing a condition. We have volunteers with a range of conditions, so where someone doesn't have the same condition as yourself, we'll try and match someone based on potentially region or some different demographics. But we know it's generally helpful to speak to someone who's been through living with a rare condition in general. And I thought I'd mention our regional support groups. So these are called muscle groups, and they are based throughout all regions of the UK. They're meetings that are usually face-to-face, but also online, so virtually on Zoom. And they're open to anyone, so family, friends, carers, etc. It's an opportunity to meet people in your region, to share information and advice through peer-to-peer support. And it's also an opportunity to hear from MDUK and external speakers to updates on it. Could be research, it could be fundraising information, etc. Those can be signed up online again, or you can contact us and we can put you in touch with our colleague who runs that network of muscle groups. And I just wanted to also share an update on some of the recent things that we've been doing for mental health support. So they're called virtual therapeutic support groups, and they are tailored support groups. So we've been working with a professional counsellor to design these groups. The counsellor we've been working with is called Louise Halling, and she lives with limb-girdle muscular dystrophy. So we know the difficulty of accessing mental health care support, but also a lot of the feedback we hear is that someone doesn't, really understand someone living with a neuromuscular condition. So these have been designed with this counsellor, based off of that. They're very small groups over a 6-week meeting, and they'll take place for about 60 minutes, and they're a protected and safe space. So working as like a peer support counselling group. The reason I mentioned it is because they're sort of something new that we're doing. They were recently advertised, and sign-ups have actually closed at the moment due to the increase in demand for the groups. But we're going to run these groups and see how they go, and then we'll keep people updated on any future possibilities of new groups aimed at different demographics. So some of the groups that we're doing this time around are aimed at men within their 40s and 60s. But also anyone that's in perimenopausal or menopausal. So, do keep an eye out, and if anyone's interested, we can share more information at a later point. And lastly, I think I've got a couple of minutes, sorry. I thought I'd mention the Joseph Patrick Trust. So the JPT is a welfare arm of MDUK, providing grants towards essential mobility equipment. It's non-means tested, there's no age restrictions, and it's open to anyone living with a muscular dystrophy associated condition. So the equipment is part funding, so we appreciate funding equipment privately can be an expense, but we can certainly signpost you to other organisations that may be able to provide funding. I just thought it'd be helpful to share the tariff of the rates of what you could potentially get part funding for. So powered wheelchairs, manual chairs, adaptations to power chairs, and mobile arm support. And that was me. Thank you very much for listening. I'm happy to take any questions. Equally, I know we're on time actually today, so if you want to reach me on email, I popped our information there and I'll copy that into the chat as well. But thank you very much.